hyperthermia has been shown in the animal laboratory and in humans to increase the penetration of the chemotherapy into normal tissues. The chemotherapy gets deeper into the tissues when it's applied with heat. We know that. Secondly, the chemotherapy agents that we use have increased cytotoxicity. In other words, they have an increased killing of the cancer cell when they're used with heat as when they're used at normal body temperature. And that's been very well demonstrated. And the third aspect of it is that heat in and of itself is an effective treatment of some malignancies. There are other reasons for using the hyperthermic chemotherapy. When we finish a cytoreductive procedure, say it took 6 hours, the patient's abdomen has been open to the air for a long time, the patients tend to become cold, going down to 35, even 34 degrees. The anesthesiologist who's managing all the vital signs and the blood coagulation, they're very happy that now the patient is going to come back up to normal temperature. So it's actually a very physiologic thing to do.
What kind of a temperatures are we talking about for this particular procedure part?
We like to have 42 to 43 degrees
kill
centigrade.
cancer cells. When it's given in combination with radiation and even chemotherapy, it's more effective.
System is approved to treat recurrent cancers, including breast and basal or squamous cell skin cancers.
What it does is that it makes the radiation more effective by increasing the blood flow to the tumor. You have more oxygen there, and that oxygen interacts with the radiation and creates free radicals, and free radicals actually attach to the DNA of the cancer cells and break the DNA in half. And by doing that, cancer cells can't divide.
To create a fever and I shall cure any disease. Those famous words spoken 2,000 years ago by Hippocrates, the founder of Western medicine.
According to cancer.gov about hyperthermia, research has shown that high temperatures can damage and kill cancer cells, usually with minimal injury to normal tissues.
1982.
Senior consultant and professor Dr. Niloy Datta has been researching and administering hyperthermia therapy ever since. Told us about one patient over the age of 75, unable to withstand chemotherapy for his sarcoma.
Only protons on hypothermia. There's no chemotherapy and, if possible, no surgery.
Other oncologists wanted to amputate his knee. Dr. Datta said no. After hypothermia therapy,
and the patient is walking in front of you, no crutch, he is going for ski. What else do you want? You don't want anything else, I believe.
Therapy group had a complete response of 38%. With hypothermia, it increased to 60%. Now, hypothermia is certainly a unique therapeutic modality. Increases blood flow. Yes, I think we all agree to it. It improves the tissue oxygenation. It also thereby sensitizes or increases the oxygenation of the hypoxic cells and thereby making it heat sensitive. It inhibits the DNA repair, which is, I think, one of the major factors of a loss of radiation sensitivity. It also sensitizes the S phase cells, and there are certain tumor cells like melanomas which are supposed to be intrinsically heat sensitive. That there is sufficient underlying biology to argue for a substantial benefit, and hypothermic oncology represents the strongest mean to improve ionizing radiation which we have ever seen, and is far superior to any other type of biological modifications. Most powerful way of sensitizing ionizing radiation, in fact, is heat. So if we take all these together, one thing comes out, that indeed it is a potent radiosensitizer. It has also been shown to be synergistic to a number of chemotherapeutic agents, and above all, that there is no significant added morbidity. So therefore, is there any treatment which is as unique as hypothermia? I don't think so.
Applying heat to the cancer tumor can boost the immune system to recognize the invasive cancer cells. Heating a cancer tumor to 42 degrees Celsius, considered fever temperature, will stress the cellular function of an already poorly developed cell structure, causing cell death. Healthy cells recover quickly from this stress effect.
The thing about hyperthermia, it's one of the oldest treatments there is for cancer treatments, and way back in the 30s and 40s, what they do is they would put people in chambers and they basically would heat them up, because one of the things cancer cells don't like is heat.
When a high frequency is applied to the human body, the bipolar molecules, ions, and electrons in the body have vibratory motion according to the polarity that changes 460 times per second. And as a result, collision and rotation occur between the molecules and generated the frictional heat in the deep part of the human body. When heat is generated in the deep part of the body, as the temperature in the body rises, leukocytes and metabolic enzymes are activated, metabolism becomes active, and all cell and organs function becomes smoothly. Malignant tumors invade surrounding tissues and are transferred to other organs and required high levels of metabolism. However, when heat is generated through deep heat, cancer cells fail to release heat at high temperature and begin to necrotize by thrombus. Hyperthermia treatment is based on the fact that cancer cells reach the lethal temperature more quickly than normal cells.